I'm Alessandro Riccombeni, National Genomics Officer at Microsoft UK. I came here all the way from Cambridge, UK, but don't be surprised, I'm actually Italian. And I ended up leaving Italy for Cambridge for one simple reason. My career has been in genomics, and at least on that side of the pond, there is no better place where you will find a similar concentration of efforts, talent, resources, vision for precision medicine and genomics. The United Kingdom has been leading the way with the first generation initiatives like Genomics England, which almost a decade ago started asking the question, what needs to be done to introduce genomics technology into the public healthcare system? What needs to be created to create the infrastructure for genomic medicine at a national scale? And the UK has been leading the way, but just in the last few years, dozens of countries have launched dozens of initiatives, which in some cases have been catching up pretty quickly with the British example. One of the projects I've been following personally is Our Future Health. This is arguably the world's largest biomedical data repository for researchers to have access to. Our Future Health just got started recruiting up to 5 million patients, to the point where almost 10% of the UK adult population is going to be participating in a national precision medicine initiatives, if you also consider Genomics England and UK Biobank. There is a lot of ambition, a lot of promise, but what does it really take to deliver this promise? What are the challenges that needs to be overcome to deliver the opportunities that precision and genomic medicine is presenting? So with our panelists today, we'll start a discussion on this topic. We look forward to your participation.
Thank you.
And I will start with the first question, and our panelists will introduce themselves with this. What is currently the biggest opportunity for your country in precision and genomic medicine?
Okay, thank you, Alessandro. Pleasure to be here. So I am Catalina Lopez Correa, Chief Scientific Officer at Genome Canada. I have been working with different genomic initiatives in Canada for the last 12 years, also working in the private sector and other international genomic initiatives. And I think, what we see now in Canada, and I think for many countries too, as a unique opportunity is, building on these large investments we have done in the past 20 years. So with Genome Canada, we started investing in genomics in the year 2000, basically with the Human Genome Project. We started building the capacity. We started really creating different centers for sequencing, also training in high qualified personnel, and really, again, building all that capacity. So now, 20 years after these investments have been made, we're starting to push the translation of that capacity and those fundings into clinical applications. One of our translational initiatives is called All for One, sorry. That is somewhat similar to All of Us in the US, but our Canadian version is All for One. So our All for One is a rare disease initiative. And the way we're building that is that each of the projects is, has a funding for an academic group that works in close collaboration with a healthcare provider, Ministry of Health or healthcare provider, to ensure that translation of the genomics fundings into concrete applications. So that's an opportunity for us to build that really translational or implementation of genomics and push it in the different provinces. That's an initiative of about $40 million in total. We are not just focusing, different from the UK, we're not just focusing on whole genome. We're being more flexible. We have exomes, we have whole genomes as part of that project. And the idea is that we will build also what we call a health data ecosystem. So it's a system to really connect those initiatives. For those of you that don't know much Canada, the way we operate in Canada for healthcare services is that those services are provided at the provincial level. So one of the challenges we have is to be able to connect what we do in the different provinces and to have more of a federal and national initiative. And that's what we're doing right now. So I will leave it there, but I can provide maybe more details later on that initiative.
Thank you so much, Catalina.
Yeah, thank you so much, Alessandro. Can you hear me okay? No? How about now?
Yes.
Is it okay? All right, good. So my name is Khalid Fakhro. For those of you who were here in the session before lunch, you'd know that I work in Qatar at a place called Sidra Medicine. I'm the Chief Research Officer there. I'm also heavily involved with the National Qatari Genome Program. So your question was about the opportunities.
Yes.
So, I would say for us, Qatar is obviously a much smaller nation. We don't have the size of Canada or the breadth of, the long history of bringing genomics into healthcare. The whole genome movement is very recent. It's only in the last 5 or 6 years that genomics has really entered the country. And I think the main opportunity for us is in targeting rare diseases. As you may know, Qatar is a nation in the Middle East, and the entire Middle East region, the greater Middle East region, really from North Africa all the way down to South Asia, is enriched for consanguinity. And in the setting of high consanguinity, large family sizes, of course, we end up seeing a high occurrence of recessive disorders. And I really think that genomics and genome sequencing is a technology that has been custom made. The best use case for it is in mapping these rare disease genes. So I would say the number one opportunity is around gene discovery for patients and families with rare diseases to shorten the diagnostic odyssey and give them answers that they can then use for therapy. However, there's other opportunities that I think we can be leaders in. One of those is in genomic data sharing. As part of the national program, we've sequenced around 40,000 adults from the Qatari population. What we've seen in the first, in this first tranche of data is that this data really represents very well the entire diversity of the Middle East. So it's not, it's not in fact, even though it's a small country, because it's a peninsula within a peninsula, our ancestors loved the beach life. So it turns out that there's incredible diversity in terms of ethnic backgrounds that are sitting inside this small country. So because we're small, we're able to access those alleles, we're able to curate them, we're able to make them available for public data sharing. I really think that that's, we're trying to lead the way in terms of bringing genomic data from the Middle East into the public sphere.
Thanks, Khalid. Thanks, Catalina. I think this is really exciting, especially if we think about how much development there has been, even for countries which introduced genomics in the 5 years or even more recently. One opportunity that I think is often overlooked is the opportunity for infrastructure, in that genomics data, especially whole genome sequencing data, tends to have such a massive footprint on public infrastructure that just its introduction in the healthcare system requires some modernization of existing systems. This is a critical topic for the UK right now. There's going to be a push to, we're starting with a pilot, to sequence newborns. The idea is that the whole genome sequencing is not going to be just some assay, it's going to be an asset that is available for the lifetime of a patient. The UK has a birth rate of around 700,000 newborns per year. Wow. 700,000 genomes per year, 100 petabytes of big clinical data entering the public healthcare system infrastructure before anybody creates any output from it. 1 exabyte of genomics data landing into the national healthcare system in the first decade. And if you're not familiar with the size of an exabyte, some academics estimated that 5 exabytes are enough to store every word ever spoken by mankind. So we'll get there in our lifetimes, just in the UK. This is going to create a great stress for the national infrastructure, and many discussions about the cloud, about security, about interoperability, I will say, are being accelerated because of the push that genomics data represents by itself. But of course, it's not just about the opportunity, there are also challenges, and we could probably spend an entire conference just discussing challenges around precision medicine initiatives. But what if you think about the next big challenge? What is the next big challenge that needs to be overcome to make progress in the right direction?
Well, few challenges. You mentioned one, and that's data management, data sharing. I think that's really at the core of what we will be seeing in the next 10 years. I think we have done, and the previous panel this morning with Sharon Terry and David Bentley talk a lot about, of course, the great progress we have done in reducing the cost of sequencing, advancing the technology. I think we're there in terms of our capacity to generate those sequences. What do we do? Where do we store? How do we share? How we manage? How we integrate at a national and international level, I think is the biggest challenge we have. For Canada, we saw it very, very clear during COVID. We had an investment of $40 million to $20 million to do viral sequencing for SARS-CoV-2, $20 million to do human genome sequence related to COVID. It was great. We could generate the sequences, we could generate the data. The biggest challenge we had was to share that data at a national level and share that data at an international level. So I think the data sharing, data management are for sure a critical component of the challenges we have ahead of us. The other big challenge was also discussed a little bit this morning, but I think is really a key and a core part of what we need to, the efforts we need to do in the next years, and is really an effort in terms of equity, diversity, and accessibility. I don't think I need to tell this audience the challenges we have with having almost 90% of our international databases only having data from Caucasian populations. So talking to the diversity you have in Qatar, the diversity we can bring with indigenous communities from Canada, I think that component is going to be very important. And it's not just, I think we often are talking about this diversity and equity challenge only about the data sets. I think we need to go beyond just data sets. But who is speaking about genomics? Who is really leading the agendas around genomics? I think we need to bring all these underrepresented voices to help us make genomics a much more inclusive and diverse technology. So I think for me, the diversity, the inclusion, access, and the data management are the biggest challenges.
Thanks. Thanks. And what do you think, Khalid?
Yeah, I mean, Catalina did a great job of covering most of the challenges that we all share. I would add probably two more challenges to that. The first is managing public expectations and return of results. So how do you talk to people? How do you develop a workforce that understands genetic counseling? How do you educate physicians? How do you educate the public so their expectations of what's going on? For example, you mentioned newborn sequencing. There's a lot of debate, a very heated debate, rightly so, on whether or not there's any merit to that. Obviously there's very good use cases, but for most healthy newborns, how do you use that? And perhaps the answer is today we don't know enough, but tomorrow having the genome would have been a good idea in retrospect, and so that's why we should roll it out. So that's one of the major challenges that I can think of. The other one is a challenge specific to Qatar and maybe the Middle East, is there really is no biotech or industry community, right? Everything is funded centrally from the government. The government made substantial investments to get to where we are today, and I think we're very thankful for that. But when you don't have that interplay between industry and academia and research, you end up losing a piece of the innovation puzzle. So you suffer from speed, you suffer from other aspects. So I think that in terms of opportunity, that's one of the biggest opportunities. And I think in this forum, I'd like to invite any companies that have ideas or that want to relocalize or have an office or presence in the Middle East to actually think about Qatar, because we've already built everything we can in terms of the infrastructure, in terms of the research, in terms of the academia and the healthcare, but what we're missing is really that industry component.
Yeah. Very, very good point. And from my side, one key challenge which is particularly critical at this moment is the human challenge. What I always tell people, if you have enough time and money, you can probably sequence everybody at some point, but first there's a long list of people you need to get to agree to that. And in the UK now we're moving towards a federation of public infrastructure. So federating research centers goes together with federating hospitals, clinics. Just in the UK, there is a minimum set of 24 population scale platforms which need to be federated in the immediate future. The 7 genomic laboratory hubs, the 4 main national precision medicine initiatives, 2 central platforms, what is currently Palantir for the federated data platform from NHS England and NHS Digital, all the national secure data environment, and a new set of 11 regional platforms which start at a base of 5 million patients each. Each of these platforms bring together a set of universities and hospitals, and there is currently no harmonized standard for interoperability, data governance, and in all of these on-premises and cloud infrastructure already there with best practices, the human factor is going to be probably the biggest limiter in moving all of this in the right direction. And I suspect that different kind of vision might be needed. For example, at the level of data controllers, we often see researchers enthusiastic about sharing their data. However, the people most excited about the data are not the people who are measured about what happens with the data. Ultimately, I think that a key challenge will be measuring data managers, the people who respond about data breaches, in terms of how frequently, how extensively the data is shared. I think that if we get to the point where the performance review of a data manager includes KPIs on data sharing, that will be an important first step in dealing with the human side of things. And talking about people, how can the international community come together to overcome some of these challenges? What are your thoughts? Maybe Khalid, would you like to start?
Yeah, sure. So, I think actually over the last 5 years, the international community has come together much more proactively. It used to be reactive, and now we see these proactive, these big consortia and alliances that are focusing on how do we establish. I think the number one thing is standards, right? We need to establish standards. We need to establish access. We need to establish equity and diversity, as as was mentioned earlier. So I think this is a role that no individual country or health system will be able to solve for themselves. It really is a combined problem for everyone involved. For example, standards on data federation. How do we access the data? What's the safest way to exchange it? Standards on return of results. Standards on what should be the minimum amount of feedback that's received by a participant. Should you feedback incidental findings, things like that? What would be considered for incidental findings? So all of these are basically questions with a lot of debate, and they all have very active communities working on them. But we need a body or several bodies that sit together and really think about how do we make sure that what we do is very inclusive, so that every country around the world that is embarking on a national program can say that they're doing a version of it. You cannot have things that only specific countries will be able to benefit from. And vice versa.
Yeah, I would say that going back to the COVID example, I think we saw really a great international movement and coordination around COVID genomics. I think we were able to somewhat push the boundaries and, as you were saying, develop international standards for data sharing, develop and see just a database with GZ where all viral data sets were deposited. We saw also capacity was being built in developing countries and emerging economies. So countries that were buying sequencers are starting to sequence just because of this, global emergency. Now the challenge we have is, can we maintain that? I think we were able to, advance in the right direction and start this more international dialogue in terms of data sharing standards, minimum metadata that is shared, and the use of the data. But I don't see that translated to other areas. Can we just maybe replicate that to rare diseases? And rare diseases is, I would say, from all the applications in genomics, is the one area where we see a little bit more of an advancement in terms of international initiatives and global initiatives, but still we're not at the level we were with COVID. And with COVID, well, lots of things work well. Lots of things were also challenging. We saw situations where emerging economies were sharing the data and they were penalized because the data was shared. We saw the example with South Africa when they shared the data about one of the variants and the borders were closed for South Africa, not for the rest of the world. So I think there's a lot of learnings we can take from that experience, that global experience on how genomics can be used. The other thing is that what is interesting is that because of those COVID genomics initiatives in many countries, and I talk about Canada, we were also able to build much more decentralized capacity. So in terms of sequencing, where we're able to bring genomics and bring sequencing capacities and train people in more remote provinces that were not equipped before the pandemic. So I think that's a positive consequence and is bringing us to more of this international dialogue. But yeah, there are challenges still in terms of our, as I mentioned before, the equity, the diversity, and the access to the technology is really a challenge to be able to truly talk about an international effort. We need to make sure that we have that capacity and that access and those individuals at the table to be part of those discussions.
I completely agree. When I think about Europe, there is a project which I'm excited about, while also recognizing its huge ambition, B1MG, beyond 1 million genomes. More than 20 European countries, plus UK and Norway, coming together with an agreement to share 1 million genomes among themselves. We already have challenges in terms of federated data sharing and analytics inside one state of a country. Now we're talking directly about more than 20 European countries trying to deal with more than 20 different legislations. I'm personally very excited to see how that community will work through those challenges, how they will work with legislators. Something that I see as highly valuable is the work done by the Global Alliance for Genomics and Health, not only because of the standards they've been developing for the last decade, because it's been really one of the best vehicles to bring together hundreds of volunteers and experts from the international community to sit at the same table, look at the same problems, and realize what are the technical challenges and what needs to be done. There's probably still a few miles in the journey to see those standards implemented in a clinical environment, but I think it's a near fundamental first step. And as we talk about participation, in this initiative, we always talk about public sector initiatives, industry networks, but what is the role that patients play in this?
Really important question. And for us, well, we have been working historically at Genome Canada very closely with the academic communities. We're working also with industry. And the group we're trying to bring now to our projects, to our discussions, is the patients. And that is not super easy. It has not been a very easy endeavor for us. We're trying to also bring the patients to look differently at the data and think about the data, and us to listen what the patients want to do with the data. I go back to the COVID example. We did a survey when we were collecting samples from individuals to sequence their viral genomes, because all the public agencies were so concerned on how this data will be used. This data has to be private. And then the patients and the individuals were saying, we're happy to share. We're super happy to share. So sometimes we, from a government or funding agency perspective, I think we tend to be much more protective than what the patients are hoping for. Many, and we have seen it with examples as Genetic Alliance with Sharon and many others, where really the patients want to be involved. So for us, it's an important aspect. We think it's the time for us to start really working. We have been doing baby steps, I would say, but I'm hoping we can be much, more proactive in this. Is our hope.
Thank you, Catalina. Khalid, how is the situation in Qatar for patient engagement?
Yeah, so I think it's good to differentiate between two things. A patient, who's someone who's sick, who comes and tries to access genomic medicine for an indication, and a participant, who's someone who's generally healthy, whose genome is sequenced as part of a national program. The former group is obviously much more motivated, right? Because they're looking for a result, they're looking for an answer. They've been on a diagnostic odyssey and they're trying to find peace. And I think once a molecular diagnosis is established, patients start forming these amazing communities themselves. I mean, sometimes they know their disease or their disease progression much better than the physicians would know. And I think that's why bringing them to the table is so important. It needs to be done early. It needs to be done systematically. But as I said earlier, it needs to be done in a way that ensures that their expectations are, properly managed, right? You don't overpromise and you don't underpromise. You need to be very transparent in what this technology does and what, what's the difference between research and clinical care. Clinical care is usually, yes or no. Yeah, I mean, I have it or I don't have it. Whereas research is a continuum. So being able to bring patients and participants on that journey with you is very important. I think we're going to see a lot more activity in that space.
Thanks. And actually, on the topic of research is a continuum, I thought it's worth going back to the topic of having whole genome sequencing available for the lifetime of a patient. Yeah. In this conference, with the increasing number of sequencing technologies coming to market, we raised the topic of what does cheap genome sequencing mean, cheap or high quality and decently priced. But the thing is, even if whole genome sequencing was $1 per patient or $0 per patient, the cost of managing and storing 100 gigabytes of patient data for the lifetime of a patient is orders of magnitude larger than whatever single-digit dollar number we'll get to. Yeah. So one question, I guess, probably for a different discussion will be, what do we do with omics data for the long term? Do we discard it entirely? Organizations which receive funding today to generate omics data, are they also going to receive funding to manage this for the long term? These are actually decisions to be made in the near future. And when we look at what is the role of industry partnerships, very often industry partnerships are essential to just make this possible. I'm a public sector organization and setting up an initiative. It's a pilot. Now we want to scale up this pilot. And suddenly, I can no longer fit into the budget my government is giving me. And very often, the only way to support a public sector precision medicine initiative is to have a private sector partnership subsidizing that initiative in exchange for research collaborations. This has been happening in the UK for quite some time. I wonder, how is the situation in Qatar and Canada? Catalina?
Well, as you just mentioned, I think what we're facing now will be the data challenge and the data management challenge in terms of, we build all these biobanks, we start to think what we do with the sequencing, what we do with the data. Do we really think the tendency in Canada for now has been we keep the data, we try to find ways to store the data, but the sustainability of most of the infrastructure and databases we create is a challenge, is a real challenge. We don't have, as you know well, we don't have the 1 million or the 100,000 or the. We have been working more in applied initiatives and more a little bit kind of on project by project basis as opposed to a national initiative. But we're facing the same challenges around data, and I think it's a very fair question you're asking. Is it maybe more cost effective like you do with your glucose profile? You don't keep that, you change, your genome changes over time. So maybe every time you have a medical question, you do a new genome. If the cost is really low, that may be the way we have to migrate. But yeah.
Khalid?
Yeah, I mean, I would say along the same lines, and as I alluded to earlier, there is very limited industry presence in the Middle East in general. I mean, one of the industry partners that has recently come to Qatar is Microsoft, and they came to deploy the Azure cloud, and so that's helping us, for example, scale. Moving some of our pipelines, moving some of our data, to further data sharing and so forth and so on. But I think it's too early for us to talk about industry collaborations now in my context. So I'll defer to you and your opinions.
Thanks, Khalid. Thanks, Catalina. I think it's a great panel. I learned a lot. We might have a minute left for one question from the audience. So, anybody?
We're out of time.
Okay. Then I guess I will ask one question myself very quickly in the seconds we are left. What is the role of having how much difference does it make to have a government mandate for such initiatives?
I think it's very important. I think it's really, it is important to have that ecosystem where you have the government buying in and supporting, like you have in Qatar, like they have in the UK. Also have that environment where you have industry that is thriving and the academic sectors. It's these three parts that I think make for a successful recipe in genomics and advancing the implementation: the government, the industry, and the academics.
Thanks.
Yeah, so in the Qatar setting as well, the government played a very important role, not just in funding this, but also in enabling it, right? Because if you're doing this, if you're doing genomics into healthcare, you need the entire healthcare system to understand what's the new technology that you're bringing. You need the education system to come in and set up master's and PhD programs in genomics and precision medicine and genetic counseling and these kinds of things. So these are sectors that you cannot influence yourself. And that's why I think having a government mandate is so important as an initial step. Without that buy-in, there are so many challenges that you're going to face trying to scale up.
Thanks. Thank you so much, Khalid. Thank you so much, Catalina. It's been really great having this panel with you. Thanks, everybody, for your attention.
And we have Sharon closing.